Created with free version for non-commercial use.
Examination of the breasts is important for both female and male patients. While the techniques of examination for men and women patients are similar, the female breast is usually more dense, and its examination should therefore be more thorough. The size and shape of normal breasts vary widely as a result of heredity, age, nutrition, endocrine activity, parity, lactation, and pregnancy. Inspect the skin over the breasts, noting any abnormalities. Then, inspect the contours of the breasts carefully to detect any masses, dimpling, or flattening. Next, inspect the nipples and areolae. Ask the patient to raise her arms over her head. This is the first of 2 arm movements that may bring out skin dimpling or asymmetry that suggests an underlying lesion, such as cancer, that attaches breast tissue to the chest wall. With the patient's arms raised, inspect the axillae, noting any rash, infection, or unusual pigmentation. Breast masses often occur in the upper outer quadrant. Palpate the tail of breast tissue and any lymphadenopathy up into the axillae. Next, ask the patient to press her hands against her hips. This second set of arm movements may bring out skin dimpling or asymmetry. Now, lower the head of the examining table and guide the patient to a supine position. Position the patient carefully in order to examine both the lateral and medial portions of the breast. Place a small pillow under the patient's shoulder on the side you are examining and ask her to rest her arm above her head. The left chest should be draped. This position helps to spread the breast tissue evenly over the chest. Begin with the lateral portion of the breast. Palpate in the tail of Spence that extends into the axilla and progress in a straight line down to the bra line. Then move the fingers medially. With your fingers flat on the breast, compress the breast tissue gently against the chest wall. With the pads of 3 fingers, palpate in a smooth rotary motion, assessing the breast tissue for consistency, tenderness, and nodules or masses. Use a systematic pattern to palpate the entire breast. A pattern of parallel lines is currently the best validated technique for detecting breast masses. Although normal breasts may be diffusely lumpy, try to identify any nodule or mass that is larger or different from the rest of the breast tissue. To examine the medial portion of the breast, reposition the patient.
Okay, go ahead and roll back onto your back. Straighten out your legs.
Then palpate in a straight line between nipple and bra line. Then up to the clavicle using the same systematic pattern as before. Finally, palpate the nipple, noting its elasticity and checking for discharge. Now drape the right chest and repeat these techniques for the left breast.
All right, now would you please
Although examination of the male breasts may be brief, it should not be omitted. Inspect for symmetry and size, and inspect each nipple and areola for nodules. Then, palpate the breast tissue and areola for nodules. And check the axillary lymph nodes using the same technique used for female patients. The male patient's arms can remain at his side. If the breast appears large, at the areola, try to distinguish soft fat from the firm disc of glandular tissue.
Created with free version for non-commercial use.